In the first video, we explained about the National Lead K efforts and how we already have similar laws here in Minnesota since 2007. In the second video, we will explain how the laws we have for language acquisition and kindergarten readiness for Minnesota children who are deaf, deafblind, and hard of hearing. In this video, we will explain the remaining laws. There are many laws in Minnesota for language acquisition and reporting. We will briefly explain each law and we will provide the law and statute number 2. We also want to make sure it is clear that while we successfully advocate for these laws and we continue to track their results, other state agencies or organizations are responsible for the implementation and do the day-to-day work. We will explain who. Here's a quick explanation of EHDI and Part C. EHDI stands for Early Hearing Detection and Intervention. Part C is the program for special education services that Minnesota Department of Education provides to children from age 0 to 3. It can be challenging to remember who's from the Department of Health and who is from the Department of Education, so we will explain. Both agencies have an agreement to share data with each other, like evaluation data, but nothing that identifies a child or family so that they can track outcomes better. MDE has a Part C EHDI coordinator since 2007. MDE EHDI coordinator ensures a seamless transition between the identification and educational intervention as required by law. Also, the coordinator oversees 15 EHDI teams around the state who train service providers to complete and develop mental assessment, including language acquisition and kindergarten readiness for children. The results of the assessment, again, data only, are reported to both MDE and MDH. Also, the EHDI coordinator receives input from the EHDI Advisory Committee. Parents receive reports about their child every 6 months. MDH has 2 EHDI coordinators who work in the 136 goals, which focus on universal hearing loss screening. In case you missed the first video, the 136 goals are hearing loss screenings by 1 month, confirmation of hearing loss by 3 months, and beginning intervention services by 6 months. The coordinator gathers all the collected data from the assessment and reports it biannually to the legislature. MNCDHH and EHDI Advisory Committee is required by law. In 2017, the Visual Communications and Sign Language Checklist for Deaf and Hard of Hearing Children, VCSL, has been added to the list of assessments used by teachers who have advanced SLPI score and have been trained to use the tool. The Minnesota Deaf Mentors were also trained to use the VCSL to collect data. This year, the Deaf Mentors are partnering with the teachers in a pilot project to see if the partnership offers more accurate data. Why is this a big deal? Before Gallaudet launched VCSL in 2016, no assessment tests existed to measure ASL language development. Before this year, the Deaf Mentors have never partnered with the educators. Minnesota is the first state to partner Deaf Mentors with early childhood teachers. We flew Dr. Lorene Sims to train our teachers and Deaf Mentors on VCSL during the 2017 collaborative experience. The data will be jointly collected and reported by teachers and deaf mentors. When enough data is collected, data is needed from at least 10 families to keep family identities private. It will be included in the biannual report. We are excited. We have a national audience who is watching our state because we are the first. This advisory committee is mandated by the Minnesota statute section 144.96. Representatives from various stakeholder groups develop EHDI medical and educational guidelines. In the statute, it requires 2 deaf representatives to be part of the advisory committee. This committee measures the reports and results to the state and the Center for Disease Control and Prevention, CDC, biannually. In this report, they include the percentage of parents who use deaf mentors, deaf and hard of hearing role models, and parent guides, along with the data collected from 136 goals. Did you know that deaf, deafblind, and hard of hearing people are involved in this journey? They serve various advisory board and committees, including EHDI Advisory Committee. They are deaf mentors, deaf and hard of hearing role models, and parent guides. They are teachers, paraprofessionals, counselors, and more. They contact their legislator and help get important laws passed. Giving our children a good start in life involves families, service providers, state agencies, legislators, and community advocates of various hearing identities. It is truly a collaborative effort, as demonstrated by the stakeholders of the collaborative plan. Learn more about the collaborative plan and see who is involved on MNCDHH website. In our next video, we will share how these laws and programs make a difference to children who are deaf, deafblind, and hard of hearing here in Minnesota and their families.